So today in this presentation I'll be discussing mental health promotion. I was asked a question by one of the students, and I decided to make a presentation about it. First of all, we need to know what mental health promotion is. As per definition, mental health promotion is any action taken to maximize mental health and well-being among populations and individuals. This definition is by World Health Organization. Okay, so from this definition we understand that mental health promotion focuses on people who are mentally healthy and not people who are sick, because its focus is to maximize mental health and well-being of the individuals. Okay, to maximize meaning people are already healthy, but you are trying to improve their mental health further, or to make them maintain that good mental health status so that they don't become mentally sick. Okay, mental health promotion activities. What mental health promotion activities would you implement if you are a community mental health nurse or a community nurse? These are some of the mental health promotion activities. Number one, early childhood interventions. These are very important. For example, you conduct home visits for pregnant women, preschool psychosocial activities, combined nutritional and psychosocial help for disadvantaged communities. Okay, so you conduct early childhood interventions in the communities to people, and also a support to children. You provide support to children, of course. For example, you introduce programs that focus on skills building. Also, child and youth development programs, those may also help to support the children in the community. Also, socio-economic empowerment, especially for women, that may be another mental health promotion activity that you would initiate. This will prevent women or people from becoming financially stressed, which may lead to mental illnesses later on. So you can promote this socio-economic, you can introduce the socio-economic empowerment of women by improving access to education and micro credits. Okay, social support for elderly people, for example, befriending initiatives, community and day centers for the aged. Alright, so you provide the social support that the elderly require by introducing these kind of services. Also, sometimes elderly people need support. We call it it's financial support. Those who are, because they are not able to work. So in countries like Zambia, we have what we call social cash transfer, which is meant for the elderly people and the widows. Okay, so such programs are meant to promote mental health among people. Also, violence prevention programs, for example, community policing initiatives. In the community leaders may decide to introduce neighborhood committees that will be making sure that there is peace in the community and there is no violence. So the neighborhood committees will be working in conjunction with the police, okay, to maintain low levels of violence in the community. Introducing and supporting recreational activities, for example, recreational activities such as ball games, athletics, etc., must be supported within the community as well. So these activities will actually work as mental health promotion activities because they will keep people fit and also divert people's attention from abuse of drugs and to having these health recreational activities like football and other games. Community development programs, for example, communities that care initiatives, integrated rural developments may also promote people's mental health. When people have good roads, they have access to good healthcare services, that will help promote mental health in people. So there are a lot of other mental health care promotion activities that you can put in place, but these are just a few that I have mentioned for you. Barriers to mental health promotion. There are many barriers to mental health promotion, some of which are lack of resources, lack of knowledge, lack of cultural support, unstable politics or political environments, lack of funding, lack of community involvement, lack of human resource, etc. So lack of resources to carry out mental health promotion activities may be a barrier. Such resources may include financial resources. So whenever you want to carry out any mental health promotional activities, some of those activities will require finances, but if you do not have finances, you are not supported financially, you may not be able to carry out the mental health promotion activity. Okay, some finances may be required just for transport. Maybe you want transport to move to the place where you want to go and promote mental health or to visit your clients, but you do not have that transport. Okay, lack of knowledge. Healthcare providers may lack knowledge about mental health promotion activities and how they should be carried out. This lack of knowledge could be a result of lack of awareness of policies that usually promote and support mental health promotion. So sometimes healthcare workers are ignorant about mental health promotional activities. They don't know about anything to do with mental health promotion, and that's why they are not carrying out mental health promotion in the communities. Lack of cultural support. Living in an environment that does not respect culture may actually cause unstable emotions among communities and lead to failure to achieve the goal of mental health promotion activities. Okay, living in an environment where the culture of the people is not respected, it may cause confusion and violence amongst people in that community. So we need to respect. Culture must be respected by political authorities and by other authorities in a country for mental health to be promoted. Unstable politics may cause anarchy. So political instabilities may cause anarchy and violence in the community. This may be a barrier to mental health promotion activities. Okay, because these political instabilities may lead to violence within the country. They may lead to fightings amongst people because of their because of the political parties that they are supporting, so they tend to fight. Okay, and sometimes politics also may trigger some local fightings, of course, amongst people, which may not be ideal for promoting mental health programs in the community. Lack of funding, lack of support for mental health services may lead to failure to implement mental health promotion activities. For example, if the Ministry of Health is not allocating enough funds to support your programs, mental health promotion programs at your facility or in the community, it may not be easy for you to carry out those programs. Okay. Lack of community involvement. Sometimes you may have all the resources available, and but the community does not want to be involved in those activities because they do not have knowledge of whatever you want to carry out. So that may be a barrier to mental health promotion activities. Some communities are so rigid and resistant to change or to adapt new programs or activities in the community, so that may work as a barrier towards promoting mental health. Lack of human resource. Very few health workers at the facility may lead to increased workload on available workers. This may prevent implementation of mental health promotion activities, as they may not be considered part of their duties. But because of the ignorance that some of the health workers have, they may not consider mental health promotion activities as part of their duty, and because they are overworked, they'll put away such activities that involve mental health promotion and consider on attending to patients within a hospital or the clinic premises. Okay, what are the roles of a community mental health nurse in the community? What are the roles of a community mental health nurse in mental health promotion? These roles are the same roles that we know about a nurse that we learned about in fundamentals of nursing, of course, but we are just applying them to mental health promotion. So these roles include advocating, teaching, resource mobilizing, leading, researcher, and collaborating. There are other roles that I have not listed here. So under advocating, the nurse usually acts as an advocate when he or she initiates and implements mental health promotion activities that were once not available in the community. Each patient has a right to receive just, equal, and human treatment. Therefore, a community mental health nurse advocates for patients' rights about their care. Okay. Teaching. Nurses practice this role when they teach individuals and communities on stress management strategies and other mental health topics aimed at empowering individuals with knowledge and skills they would require in living a positive lifestyle. The nurse usually provides sufficient information for clients to make necessary health care decisions. Resource mobilizing. When initiating or before initiating any mental health promotion activities, nurses require resources which would be determined by the type of activity to be carried out. Some of these resources include human resource and finances. Therefore, it is imperative that all required resources are gathered to prevent failure to achieve the intended goals. Leading. The nurse works as a leader when he or she initiates and guides clients into mental health promotion programs. As a leader, the nurse instructs, influences, and persuades others to effect change that will positively affect people's health. Okay, that will positively affect people's health. As a researcher, with this role, community mental health nurses engage in systematic investigations, collection and analysis of data to solve problems and enhance community health nursing practice. The nurse also makes follow-ups on initiated health promotion programs to determine their effectiveness as a researcher. Okay. Collaborating role. A community mental health nurse rarely works in isolation to meet the goals of mental health promotion. The nurse usually works with clients, other healthcare providers like nurses, doctors, physicians, and the social workers, psychologists, and community leaders, and school teachers, political leaders, and other bodies, of course, or groups with similar interests in mental health promotion. Okay, so that is about mental health promotion, the information that you need to know. Thank you so much for listening. Thank you for watching this presentation. Please subscribe to my channel if you are not yet a subscriber. Thank you.